Hello everyone and welcome back to J1 Aviation. So our goal is to review a couple questions from the FAA private pilot written exam every day. So today's questions are related to hypoxia. So let's begin. Okay, question number 1. Which statement best defines hypoxia? A state of oxygen deficiency in the blood. B, an abnormal increase in the volume of air breathed. Or C, a condition of gas bubble formation around the joints or muscles. Okay, the answer is A, a state of oxygen deficiency in the body. So hypoxia means reduced oxygen. The greatest concern about hypoxia when flying is reduced oxygen to the brain, since it is particularly vulnerable to oxygen deprivation. So any reduction in mental function while flying can result in life-threatening errors. So hypoxia can be caused by several factors. Maybe the most common is insufficient supply of oxygen to your body. Question number 2. Which of the following is a correct response to counteract the feelings of hypoxia in flight? A, promptly descend to a lower altitude. B, increase cabin airflow. Or C, avoid sudden inhalations. Okay, so the answer is A, promptly descend to a lower altitude. So since hypoxia means reduced oxygen, increasing oxygen can then treat hypoxia. So this would include like descending to a lower altitude or using supplemental oxygen if available. All pilots are susceptible to the effects of oxygen starvation, regardless of physical endurance or how well you are acclimated to higher altitudes. So when flying at higher altitudes, it's important that oxygen be used, if available, to avoid the effects of hypoxia. Question number 3, and this is the last question for today. Which is not a type of hypoxia? A, histotoxic. B, hypoxic. Or C, hypertoxic. Okay, so the answer is C, hypertoxic. This is not a type of hypoxia. So there are 4 types of hypoxia. We have hypoxic, hypemic, stagnant, and histotoxic. So those are the 4 types. Hypoxic is when there's insufficient oxygen available to the body as a whole. Hypemic hypoxia is when the blood is not able to transport a sufficient amount of oxygen to the cells of the body. Stagnant hypoxia is when oxygen-rich blood is not moving to the parts of the body that need it. And then the last one, histotoxic hypoxia, is when oxygen is getting to the cells, but they are not able to use it. So those are the 4 types of hypoxia. So thanks everyone for riding along today. We hope you will join us on a future flight, and thanks for flying J1 Aviation.